You know, our specialty is a very, very high, intense. So my next question to you is, how do you manage burnout, or how do your other colleagues manage burnout?
So you've seen that I probably struggle with balance in my professional and non-professional activities, but I think there's a lot of evidence behind this actually that people do different things to try and relieve stress. And stress is something that is inherent in our specialty, and probably a certain type of personality gets drawn to EM, and a lot of them are type A personalities, and thinking on their feet, but also can get stressed easily. So the thing that people meditate, people pray, people do yoga, listen to music, but the one thing that's evidence-based that works for everybody, regardless of what their preferences are, is exercise. So regular exercise is definitely a way of reducing stress. And when you talk about burnout in particular, again, there's evidence that if you want to reduce the risk of burnout, you've got to break the cycle. How do people get burnt out? They get up, they go to work, they come home, they go to sleep, they get up, they go to work, they come home, they go to sleep. It becomes a monotonous, boring cycle that they can't break, and that's when they burn out. So the evidence states that you need to have a hobby that you are properly invested in, not something you do once or twice a month, something you regularly take time out to do. And how it breaks that risk or reduces that risk of burnout is you get up, you switch on your work mind, you go to work, you come home, you switch off your work mind, you switch on your hobby mind, you do your hobby, you switch off your hobby mind, and you go to sleep. And that's so different to what I described earlier. Exactly. And my hobby, probably my first love since I was 12 years old, has been table tennis.
Oh, wow.
And being able to progress within the table tennis world as an umpire, and also now as a classifier for para-table tennis athletes, has meant that hobby is helping me maintain my well-being.
What advice would you give any doctor who wants to take the path of SAS?
My advice is always very similar. SAS is a career choice for a lot of people, but it's also the first entry point sometimes for international medical graduates. So my advice to those who are already in the specialty and working as SAS doctors is think about where you want to be in 5 years' time, in 10 years' time. And if what you foresee is working as an SAS doctor, not taking on the responsibilities of being a consultant, go for it. Build your interests, build your niche areas. There's so much work to be done in the NHS that you don't have to be restricted to just your clinical service provision. I'm a qualified medical examiner, for example. I don't undertake that role at the moment, but it was something that I found exciting and interesting, and I took it on. I'm a clinical safety officer at my trust, again, something that helps me find different areas where I can contribute. So that's my advice to people who are already in the specialty. If you want to see yourself in 10 years' time on a consultant post, then work towards your portfolio pathway application. For international medical graduates who are new to the NHS, my advice is always don't step into a role before you are fully prepared for that role. A lot of people who come to the NHS from abroad are brought up in a system of medicine where it is a sign of weakness to go and ask for help or advice about your patient, and it's a sign of incompetence. That's not the case in the NHS. I work at the consultant level in my department, but I work very hard to break down any hierarchy, because if I'm not approachable, then that's detrimental to my patients.
Following that, I guess you want to say mentorship or support is very important, especially for those that just starting their career in emergency medicine or any other specialty.
Absolutely. I mean, I cannot say that I would have been where I am right now if it wasn't for the support and mentorship, not only from my colleagues and other SAS doctors, but also my supervisor, who was a consultant that also happened to hire me. So you need to have some support, you need to have mentorship, and I think those informal buddy meetings that we can sometimes have are very, very invaluable, especially for somebody who's new in the system. We don't realize the impact it can have. And having reflected on that, the one thing I've learned over the past few years is I don't ask somebody how they're doing unless I'm fully committed to being able to stop and have a conversation with them in case they tell me they're not okay.
Right. So, Immad, looking back on your career, are there any key lessons or insights that you've gained and you'd like to share with us?
Yes, absolutely. I mean, there's things that I've experienced in my career have been around being involved in complaints or incidents. Some of them have been around the same things that I talked about, asking for help, realizing that you're struggling or not doing well, and that it's not a sign of weakness to ask for that help. And as I've become a little bit more senior, I guess the biggest lesson I've learned is that a difference of professional opinion isn't a personal attack on you.
Mm-hmm. I understand. So imagine SAS Week is an important event to highlight the work of SAS doctors. What do you think are the key messages or themes that you should be emphasizing during this week?
Well, I think there are a lot of SAS agendas or challenges that we can work on, but I think in general the SAS Week from NHS employers captures the themes quite well, and this year they're running it with 5 different themes across a separate theme across each day. Monday is talking about the SAS Charter and SAS as a career choice.
Mm-hmm.
We need to promote it, we need to encourage it for people, and the only way we can do that is having SAS doctors at career days, whichever career days we're talking about. Mm-hmm. On Tuesday, on the 15th of October, the theme is about this new specialist grade, and RCEM was amongst the first few colleges that actually produced a person specification for what a specialist doctor would look like in the new grade. And our previous EMSAS Chair, Dr. Steve Black, had quite an input and was quite heavily invested in developing that document. So I think that's an area that we should be looking at. On Wednesday, the theme is about SAS doctors in extended roles and development of SAS doctors. And we've already touched about that, what the work the college is doing to promote SAS doctors, but employers need to do that as well. They need to look beyond SAS doctors as people who will run the department or provide service, and also see where else they can contribute.
Okay, so what are you most excited about the future of SAS doctors within the Royal College of Emergency Medicine? Are there any upcoming initiative or project that you're particularly looking forward to?
I think there are a few. They've gone out in my newsletters and that have gone out to college members. They've also gone out in my podcast if you've read it. But essentially, the college is opening up its membership and allowing voting rights to SAS doctors who meet the criteria to be members by election. And we had feedback from, so this was again work that Steve Black had worked on with the college and had introduced that new grade of membership to allow voting rights. But a lot of people who were applying found that it was very difficult to complete the application online. So we worked with the college and we streamlined the process to make it simpler and less time consuming. In addition to that, we as EMSAS are working on a handbook for SAS doctors in emergency medicine. And in that, we want to include our colleagues who are not on national SAS contracts but are on various locally employed doctor contracts as well. So that's something we're looking forward to. It won't be ready for our conference next month, but we're trying to make it a really good document. So I'm excited about that. And now that I mentioned it, of course, our star event every year, our EMSAS conference, which will be in Scarborough this year on the 13th and 14th of November. And I'm hoping I'll see you there.
Oh, I'm looking forward to it. Thank you, thank you. So you'll be glad to know that we've come to the end of our interview. And before we finish, I'd like to thank a few people. I'd like to thank Lawrence and Gareth. They are part of the RCEM. And I'd like to thank Dr. Shanti Ramraj. She's the SAS lead for Hillingdon Hospital. I'd like to thank Tyrus. He's our videographer. He's doing a fantastic job. And not the least, Dr. Paul Bisner, who is the mastermind behind this interview. He's also the London rep for EMSAS. And finally, I would like to thank Radio Hillingdon for agreeing to broadcast this video on the 14th, from the 14th to the 18th of October. That's the SAS week. So thank you very much, Immad, for coming, and thank you for taking time off your very, very busy schedule.
It was my pleasure. Thank you, Agnes.
Thank you very much.